Okay, good afternoon, everyone. It's Fertility Talk Live. Today we are talking to Sanya, and she is from MNI. We're going to talk about managing PCOS and its symptoms. So PCOS is something we actually talk quite a bit about. It's just because there is so many women that's dealing with infertility, because of PCOS. And there's a lot of women that actually hasn't been diagnosed with PCOS. So they have all these symptoms, and they're just, not sure what it is, and got irregular periods, acne, the weight gain, especially. There are so many other things that goes with PCOS, as well as the inflammation, which I actually learned a couple of months ago only. So we are going to hear from Sanya, and she's from MNI, and she's going to give us a bit more information about what it is that they have, and what is it about their product that works, and just more on PCOS and managing it. So thank you for joining us, Sanya, and we're really excited to hear what it is that you have to say to us about PCOS and managing it.
Thank you, Leanne. Thank you for the opportunity. It's a great opportunity to talk to the ladies. So yes, I'm from the Medical Nutritional Institute, and at MNI, our main function is lifestyle-related conditions that is associated with the metabolic syndrome. And we believe in targeting the underlying cause of the condition and not just the symptoms. And today I want to focus your attention on insulin resistance, the underlying cause of a variety of health problems with many negative effects in the body. So we know that insulin resistance causes unstable blood glucose and weight problems, but it also causes hormonal imbalances, and that leads to skin conditions, and it also plays a pivotal role in developing PCOS.
Okay.
So we offer a few products in the MNI product range targeting different aspects of insulin resistance. And today I would like to share information about OviVance, specifically designed to optimize female reproductive health and ovary function by combating hormonal imbalances and insulin resistance related to common reproductive and metabolic disorders like PCOS and the metabolic syndrome. Now, at MNI, we are passionate about training, and we have an extensive condition-based approach in relation with our products. But I believe that you ladies are also well informed and experienced, that I'm going to try and keep it short. Yeah. Okay, so we know that PCOS is a hormonal disorder, and the presence of PCOS may result in abnormal menstruation, problems with normal ovary function, and also infertility. Yeah. We know PCOS is one of the leading causes of female infertility in the world. And it may also result in cosmetic problems like acne, abnormal hair growth, hair loss, or male pattern baldness, hyperpigmentation, and then also weight problems. But the most important thing is that PCOS is not a clear deviation. Each person may experience different degrees of the symptoms. Some may have only one or two, and some more than that. And this is why it is so important to choose a product that don't just target the symptoms, but the underlying cause. Yeah. Yes, absolutely. And insulin resistance is a progressive disease that increases in severity over time, and with that, the effect that it has on your body. So if insulin resistance as the underlying cause is left untreated, the symptoms will return or even increase as insulin resistance increases. So there are also other medical conditions associated with PCOS, especially in the presence of obesity. PCOS increases your risk of both gynecological conditions and a wide range of other diseases. And the most important are the metabolic syndrome and metabolic syndrome associated disorders. So more than half of women with PCOS develop diabetes or pre-diabetes before the age of 40. It also increases your risk for developing high blood pressure, cardiovascular disease, obesity, and then also, like you've mentioned, Leanne, chronic low-grade systemic inflammation. Yeah. Then reproductive disorders and complications includes gestational diabetes, preeclampsia, pregnancy disorders. And PCOS might also increase your risk of developing uterus cancer. So women with PCOS, 3 times higher risk for uterus cancer than someone without.
I've never heard that, to be honest. So that's a good thing to hear.
Yeah, so we know it's a serious condition, but the good news is that it responds well to treatment. So we have to look at treatment options, and we have to understand that it's a complex condition because so many different underlying factors. And therefore, a combination of strategies is needed. So the first thing you can do is lifestyle adjustments. So lifestyle adjustments is recommended for every woman with PCOS or any of its symptoms. Healthy habits can reduce insulin resistance and its effects, and that may result in ovulation recovery and also improved fertility. So these healthy habits is to maintain a healthy weight, to avoid high carbohydrate or processed foods, and also exercising. Exercise helps to lower your blood glucose levels, it reduces inflammation, and it also increases hormonal regulation. So at M&I, we have a holistic approach to healthcare, and we offer lifestyle support in the form of the insulin-friendly Cape meal plan and also exercise programs, and that is available to download for free from our website.
That's awesome.
Yes, but as we know, often lifestyle changes is simply not enough, and you need a good you need a good supplement that is scientifically supported as part of your treatment strategy. So M&I has developed OviVance tablets. It is the only product that contains the unique inoline F blend, and that helps to combat PCOS and its symptoms. It helps with irregular periods. It helps to regulate and improve ovulation. It also optimizes female health, and it fights insulin resistance that is associated with your common reproductive and metabolic disorders. So if we look at the OviVance formulation, OviVance contains essential and exceptional high-quality ingredients. So the unique inoline F blend contains myo to D-chiroinositol in a 40:1 mixture. It also contains folate and choline. And independent research shows that this specific ratio that we use in the inoline F blend leads to a more rapid improvement in hormonal imbalances as well as insulin sensitivity. And then OviVance also contains a blend of vitamins and minerals. It's in optimal amounts, and each of these was carefully selected based on the scientific proven results that it has not only on reproductive health, but also general women's health and well-being. And another major advantage of OviVance is that it is not only formulated to use before pregnancy, but also during pregnancy. So the OviVance, it's a complete solution for the health of mom and baby. So if you look at your pregnant mom, OviVance helps to stabilize your blood glucose levels. It reduces your risk of developing gestational diabetes, and the formulation also optimizes uterus and placental health during the pregnancy. It prevents the development of neural tube defects and also improves neurodevelopment of the growing fetus.
That's before you go on. We actually never hear of a product. They normally say, as soon as you conceive, and our ladies here on the platform, it's I would say 99% of us, we're here because we are struggling to conceive. They're dealing with infertility, and PCOS is one of the major causes, I would say, of infertility. I mean, I suffer from PCOS. If you saw the whole of me, you'll be like, okay, that's PCOS walking right there. That is how bad my PCOS is. And a lot of times you are always told, as soon as you conceive, stop it. And you get a lot of questions of, I'm on this product, and I've just conceived, do I continue taking it? But it's nice to know that this product, you can actually continue taking it, because I do know that, you know, PCOS is not what people need to understand, or like women need to understand when you've got PCOS. It's not something that is just, oh, let's just take it for a short while until we conceive, and then when we're done with it, we'll take it for 3 months. I must conceive now and then done with it. PCOS is a lifestyle change. You literally have to stay on it, because PCOS doesn't go away. It's not like, you know, a common cold or flu, and you have the flu and you take your medication, and when you're done with the medication, you know, you stop it right there. So it's also a lifestyle change to continue. But it's, like I said again, it's very nice to know that you can actually continue this while. So it's like your supplement that you have to take when you're pregnant as well for baby, which is absolutely awesome.
Yes, so yeah, it's a great advantage that you can also use it during pregnancy, but then you can also use OviVance from the age of 12. So not only during pregnancy, but so teenage girls can also use OviVance. So if you look at teenage girls, they also experience hormonal imbalances. It's normal. Yeah.
If I may ask a question, I hope you don't mind me butting in and asking, but it's nice to hear, to speak to an expert and, you know, hear the opinions about it. But do you find that more and more girls, younger and younger, they are showing signs of PCOS these days? You know, I only found out when I found out when I was 16, but I still didn't know what it meant. But do you find that younger and younger they are now being diagnosed with PCOS? Because of lifestyle and things, or?
Well, I think there's just more it's the condition is better known now. So
okay.
So yeah, there's a lot of light on the subject. So
yes.
But if you look at teenage girls, you can you can use OviVance to help regulate your cycle. Although it's normal, it may be disruptive. For the first few years after its onset, it is irregular. Or it's common for it to be irregular. So you can use OviVance to help get your cycle regular. But then, like you said, the symptoms may be early signs of a more serious underlying condition, such as PCOS. So if we look at the early symptoms of PCOS, unregulated cycle, heavy flow, or maybe a total absence of a cycle. Pain, acne, excessive hair growth. So in this case, it's very important. Early intervention and treatment is important. It's necessary to prevent serious future health issues. So if we can identify these symptoms earlier, and I said you can use it from the age of 12 years old, it can prevent serious future health. So OviVance is a great choice for teenage girls as well.
Wow. Okay, that's great.
It's not habit forming. It contains only plant-based ingredients. It's safe, effective, it's well tolerated. And it can also be used in combination with most other prescription medication.
That's great to know.
Your dosage is 2 tablets, 1 day with a meal. You can take it at any time of the day, but we recommend for optimal results that you take both tablets together at the same time.
Okay, that's awesome.
So I think just to conclude, just remember that with OviVance, we target the underlying cause of hormonal imbalances and not just the symptoms. And thereby we optimize female reproductive health and ovary function.
Okay, I'm actually sorry, I'm looking away. I'm actually just checking my phone to see if there's any. Normally we have a few questions from ladies that's watching. We haven't had any questions, but a lot of times, as always, every week I say this, is that as soon as we finish with the talk, and the messages come through afterwards. But you can contact M&I on their website as well. You can also go, if you can maybe just give your details.
Okay, yes, and so we have a panel of experts available for individual support. So if there's any questions, please contact us via email at expert@mnilifestyle.co.za. We have also a very informative website, www.mnilifestyle.co.za. And like I've said, we offer lifestyle support in the form of meal plans, exercise programs, as well as self-assessments. And that is available to download for free from our website.
So that's great. I got one other question for you. I know you've got a product. I know we're not talking about this product at the moment, but I just want to just quickly touch on it. You've got a product called Antagalin. Can you just tell me, would you take Antagalin with the OviVance, or would it be something separate, or how does it work?
No, you can take Antagalin and OviVance in combination.
Okay.
So Antagalin is specifically designed to combat insulin related weight loss or weight problems. So it's a great combination to use Antagalin and OviVance. But if you are trying to conceive, if you're pregnant, Antagalin is not tested.
Yes.
The safety is not tested during pregnancy and breastfeeding.
Yeah.
So they just have to stop taking Antagalin. But yes, it's a great combination. Okay. And you know what? I haven't told the ladies where they can get OviVance.
Yes, I was just going to ask. That was my next question.
So OviVance is available at all pharmacies. If it's not on their shelf, they can order it from the wholesalers. Or alternatively, they can also order OviVance from our online shop on the website.
And you can also order it from me. You can also, you can also order it on our online store. We stock all of it. So all the MNI, most of the MNI products, we also stock that. And or you can order it from Dis-Chem, Clicks. I know I've seen it all these places. You can order it. It's a great product, and I think it's also reasonably priced. That is the amazing thing about it. It's really a reasonably priced product. If something that you have to take it long term. Again, I keep saying it's not a product that you take when you are trying to manage your PCOS. You don't only take it for 1 month and 2 months and think, okay, that's fine. We healed from PCOS. It's management, because like Sanya has mentioned, that PCOS is something that it can cause diabetes. There's a list of things that it can cause as you're getting older and stuff. So it's definitely a maintenance plan when it comes to taking a supplement for your PCOS. Thank you very much for your time to talk to the ladies. We hope to have another one. I think we're going to have another one on Instagram, if I'm right. I'll be talking to you again on Instagram.
Yes, lovely.
Okay, great. Perfect. And one other thing I want to mention to you ladies, with OviVance, one great thing that we heard today is that when you do conceive, you can actually continue taking OviVance because it's safe for mom and baby, which is absolutely great. So thank you again for taking your time out to chat to us, ladies. We hope to chat to you soon, and have a great and warm weekend, especially because you're here in Cape Town. Okay, thank you very much.
Right now. Thanks, Leanne.
Pleasure. Bye.
Bye.